We're joined by the woman in charge of it all, the Mental Health Minister, Maria Caulfield. Welcome to Sunday Morning.
Good morning.
Now, as we were just saying there are huge numbers of areas when it comes to mental health that people are very worried about. So from your perspective, what is the most pressing issue currently?
Well, we've done a lot of work over the last few years to really change mental health because the focus previously was on people who are experiencing mental illness, which is right and proper, but we haven't been really doing before that, the work needed in preventative and early intervention for mental well-being and mental health. And I think over the last few years, we've really seen an investment in community services, in crisis centres, where people who are experiencing a crisis can get help and support before getting to that point where they need to be admitted. We're also investing in children and young people services. So we now have over 300 teams covering about 2,500 schools and colleges, where we're helping support young people with their mental health and well-being, and really putting mental health and physical health on a par. We all know that when you go and see a GP, you're told about losing a bit of weight, getting your blood pressure down, generally looking after your physical health. And very rarely are you asked, are you okay? Have you got any issues? Would it be helpful to talk to someone? We're changing all of that. We've got the Every Mind Matters website now where people can self-refer themselves for talking therapies. We're supporting local organisations into providing emotional and mental health support. So we're really trying to get mental health on a level playing field with physical health, and we are making huge progress with that.
Yeah, you see, the problem is for lots of people who experience this at the sharp end, that's not what they see. Children's mental health services are in crisis across the board. There's been a number of reports, even in the last week, about how those systems are failing children who, in some cases, are ending up self-harming and killing themselves. You've just mentioned now, you can go to a GP and get a referral for talking therapies. Most people will find they have to wait months, sometimes longer than that, over a year, to be able to access that kind of care. I mean, I asked you at the start, really, what's the most pressing area at the moment? I suppose I'll ask again, what is your focus, given where we know the problems are right now?
So we are seeing huge numbers of increases in referrals, and that's a good thing. For too long, people were too frightened to come forward with stigmas, with taboos. If you talk about children's services, we are seeing over 700,000 children now in the last year, whereas maybe a year ago that was less than 600,000. So that's a 100,000 increase in the number of referrals. And yet we are getting children through the system more quickly. We've got a target for 95% of those children should be seen within 1 week. We're at 77%, which is not 95%. But a year ago, it was less than 60%. So despite the increase in numbers coming through, we are making progress. And that's with record levels of investment. We've got £2.3 billion additional funding going through now every year into mental health services. But that does take time to build that capacity to see people. But compared to where we were 4 or 5 years ago, we're making huge strides.
Yeah.
That's not
and I
where
think,
we want
I think
to be.
Lots of people would understand that. And I'm sure people listening will hear what you're saying about the extra money that's going in. But I think what we would really like to do today is have an honest conversation about where the problems are, not just about the extra packages of cash and whatever, because we know, if we're honest about this, that children's mental health services particularly are among the worst. Some children are left in isolation. Some of them are moved hundreds of miles away from home because they cannot get care. There was a report last week about one of the government's biggest private providers failing in its duty to look after children, and has now basically been put on watch by the CQC. I mean, the new director of the CQC has said that services should be closed if they're not good enough. Would you agree with that? Is that where we're at now, that we need to start taking much more sort of, strict action on those services that are failing children?
Well, that's why just a few weeks ago, we set up our rapid review of all inpatient mental health services, so for children, but also for young adults and adults as well. And that will be reported back imminently into what those services are looking like, what services they're delivering, how safe they are, and what indicators we should have and thresholds we should have for taking action such as that. And the Secretary of State will be reporting back on that very, very soon, because we do have those concerns. I watch Panorama programmes like everyone else. I meet with parents who've lost children, sometimes in those inpatient settings, and absolutely I take that very seriously. But if you also look at the other end of the spectrum, where we're looking after young people in a way that mental health was never prioritised before. So the fact that we are now in schools supporting teachers, supporting young people, so that we're able to provide that low level of mental health support, and then those children who do actually need some serious intervention and with CAMS teams can be fast-tracked with their referrals. And so that is happening in schools rather than, young people and their parents having to go to their GPs and go on waiting lists for referrals. Yeah. So we're changing the whole system to try and get to people as quickly and early as possible.
Do you think that the current children's mental health system is good?
I'm the first to recognise it needs improvement. That's why we have set up the rapid review to not just do a review, but to do it quickly, to identify, because some parts of the country are providing excellent mental health support services for young people. Others, it's extremely patchy.
Yeah. So you can't say it's good. And you just said, rapid review. I mean, you called for evidence for a new 10-year mental health strategy in 2022. You dropped plans to publish a new one in January. The website for mental health reform, which the government currently runs, hasn't actually been updated with any news or information on mental health reform since April 2022. I mean, why did you drop the call for evidence on a 10-year mental health strategy? I mean, because it sounds like you answer questions about where the system is failing with offering a new review, but you did a review and then you dropped it. I mean, what happened to that mental health strategy?
That's not quite right. Firstly, we have got our suicide prevention strategy, which is going to be published hopefully this summer, which will be looking at high-risk groups and then high-risk methods as well, and supporting prevention and charities that are working in those spaces. So that will be coming out this summer. In terms of the standalone mental health strategy, what we've done is incorporate it into our major condition strategy, because you can't just treat someone with a mental health illness as that standalone. We know, for example, that if you suffer with mental illness, you've got a 15 to 20 year less life expectancy. We know that you're about 5 times more likely to develop cardiac problems or diabetes or cardiac failure. So we want to put people with mental health illnesses in with everyone else and try and level up their health overall. And so it's really important that they're seen as part of a whole strategy that's looking at all the major conditions, the 5 major conditions that affect people's quality of life as well as their life expexpectancy.
Yeah.
So all that.
And I think lots of people can understand why you might look to do that. But the problem, and I mean, Nick has texted in to say that there's more people coming forward. It's nothing to do with the collapse of the state and basically the collapse of the NHS. You say you're putting mental health in with other conditions, but that system isn't working either. People are waiting months, years for diagnosis, for other treatments.
I don't think the NHS is at collapse. I still do shifts in the NHS and it's far from collapsing. It's under huge pressure. We've got 2 years of backlogs of dealing with COVID, whether that's for mental health or for physical illnesses. But if you look at the figures that were only published a few weeks ago, our 18-month waiting list, the vast majority of people who are waiting 18 months have had their treatment. We're now tackling those waiting a year or more. The same can't be said in Labour-run Wales. So, there is pressure. You can't close down a health system for 2 years for a pandemic and not expect to have pressures there.
Yeah.
And that had pressures on people's mental health, particularly for young people who missed 2 years of school, who missed those relationship buildings with friends and colleagues who, had uncertainty.
Which is why it's a big focus for us today. Let's talk about another area that the government has made a promise on, the Mental Health Act bill. It's been plodding along. It's been promised, and it's still not emerged. When will it be law in this country?
So we did what's called a pre-legislative scrutiny process, which is the committees of the House of Lords and House of Commons scrutinised our draft bill, and I had to give evidence at that committee process. They took evidence from a wide range of experts. They presented their report fairly recently about what they would like to see changed in our draft bill, and we are just working through that process to see what we can and can't accept from their recommendations, and then we'll be presenting that response to that report fairly soon. Yeah. So that's a normal kind of legislative process, rather than just present a bill to the House of Commons and then spend days. Of course, I mean, you were given that report
you were given that report in January, though. This bill has been promised this Parliament. Can you still guarantee that?
Well, we have to. Our first job is we have to formally respond to that committee, which we'll be doing fairly soon. And then we have to find the parliamentary time then for that legislation. But there are areas of that work that we are looking to introduce anyway. So, we absolutely are committed to reforming the way mental health services are delivered. And if you look at that bill, the sorts of things that are in that bill is not admitting people unless they absolutely have a clinical benefit of being admitted. And that's why we're already producing that funding for crisis intervention centres in local communities, mental health ambulances, for example, so that if someone's going into a mental health crisis, a mental health ambulance will come and assess them with mental health professionals rather than a standard ambulance that will just have to take to A&E to be assessed, which is in no one's benefit.
But you can't guarantee that this bill will return to Parliament before the next election, can you?
Well, that's the process for the King's Speech, which is going through at the moment. That is not in my gift as a minister. There is a formal process to go through. So we absolutely have started the process with the pre-legislative scrutiny committee. That's normal for a bill to follow that process. Yeah. And we'll be responding to that, to the recommendations that they've made very soon.
So no guarantee from number 10 to you on that. I just want to ask you one more thing. The Prime Minister promised to rewrite equality laws to protect women. He gave a guarantee to people when he was running for the leadership of the party, which of course he then has become Prime Minister. Can you guarantee that will happen in this Parliament, as he promised?
Yeah, I mean, the Prime Minister has given that commitment. I'm responding to a debate in Westminster Hall next Monday, and I'll be giving some fairly robust responses to parliamentary colleagues who want that assurance. The Prime Minister has been very clear that he believes that within the Equality Act, sex should be based on biology. And I will be responding to that debate next Monday. So there'll be lots of questions from parliamentarians on all sides raising that exact issue.
Yeah, but you see, people might question why you can give me a robust guarantee that will happen, but you can't promise that the mental health bill will go through, despite the fact that it's been promised under lots of different people, lots of different leaders of your party. I mean, some people might think that mental health still remains the less important sibling of the wider NHS.
Well, I completely disagree with that. That is why we've put mental health in the major condition strategy, so it's on a par with other physical conditions. If you look at what NHS England is doing with their call 20+5, which is the 20% of the population who have the worst health, and the 5 major conditions that are driving that, mental health is there. A few years ago, we didn't have any mental health support teams in schools. We've now got nearly 4,000 schools and colleges that have mental health support teams in schools supporting young people and then referring those who need specific help. We never had mental health ambulances before, and now we are rolling those out so that if someone's going into crisis, they're getting the right help at the right time. If you look at our crisis community facilities that we've just invested record levels of capital funding in, again, so that people can get help closer to home.
Maria Caulfield, time's against us. Just got a couple of quick questions. First of all, the Metropolitan Police Commissioner saying that the police won't respond to mental health calls. Do you support that?
Well, that's part of the work we're doing with the Humberside model across all police forces, and I'm working with Chris Philp, who's the police minister, on that. We ideally don't want police having to respond to those calls. We ideally want mental health professionals to be the responders, and for people in A&E to be seen. There is a target that NHS England is consulting on.
But there aren't. I mean, a lot of people are saying there aren't. If it's not the police, there's no one who's actually got the power or the skill to respond.
That's not true, because we're recruiting an extra 27,000 mental health professionals. We've got about 20,000 already. We are creating that capacity. That's where all that funding, that £2.5 billion a
They're
year...
They're not an emergency service, though, are they? They're not a 999 service that the public can access.
They are. That's why we're introducing mental health ambulances, so that if someone phones 999 and someone's going into a mental health crisis, there will be mental health professionals rather than your usual paramedics that will be responding. They have the powers to section people if they need to when they arrive on scene.
And
that's exactly what we want.
Just finally, interesting things going on in Sussex. Your constituency of Lewes, the Conservatives lost all their 19 seats on the council. What do you think your chances of re-election are?
Well, I've always been a marginal seat. I was never expected to win the seat in the first place. At every election, and Adam, you will know this as a constituent, I've never been expected to hold my seat. But my priority is absolutely delivering for local people, and whether it's delivering the new GP surgeries in Newhaven or Seaford, or whether we've just seen the A27 upgraded and improved, there's lots of local good news stories happening in my patch. So, my job is to get on and represent the people of Lewes.
Okay, Maria Caulfield, thank you very much for joining us.